The Elder Care Protection Bill has been introduced as an important piece of legislation designed to address several issues that affect older adults across the United States. Here's what it may mean for you and your family. Take a moment to understand what is being discussed, because developments in the United States Senate can sometimes influence retirement planning, healthcare access, and long-term financial stability. Many retirees hear headlines about new bills, but rarely get a clear explanation of what is actually included. This proposal has drawn attention because it focuses on areas that many seniors care deeply about, including prescription drug affordability, long-term care standards, social security discussions, fraud prevention, caregiver support, and housing accessibility. However, it is important to understand that policy changes often take time, and not every proposal becomes an immediate change in everyday life. Some programs may require additional implementation steps, while others depend on eligibility rules or future agency guidance. In this video, we're breaking down the main ideas in straightforward language so you and your family can better understand what is being discussed and what topics may be worth following in the months ahead. Let's begin with why legislation like this is being discussed in the first place. Older Americans face a unique set of challenges that become more significant over time. Healthcare costs often rise with age, especially for those managing chronic conditions. Housing that once felt comfortable and practical can become difficult to navigate due to stairs, narrow spaces, or maintenance needs. Fixed retirement income can create budgeting pressure when inflation increases the cost of groceries, utilities, transportation, or medical services. On top of that, many families are also balancing caregiving responsibilities while trying to maintain their own work and family obligations. Prescription medication costs have been one of the most common concerns raised by seniors for many years. People managing conditions such as diabetes, high blood pressure, arthritis, heart disease, or respiratory issues often depend on multiple medications every month. Even with insurance, out-of-pocket costs can create financial stress. This is one reason prescription pricing reform has remained such a major topic in healthcare policy discussions. The Elder Care Protection Bill includes measures intended to improve affordability by expanding pricing oversight and encouraging cost-lowering strategies for certain medications within Medicare-related programs. For many seniors, this area matters because medication adherence is directly tied to health outcomes. When people cannot afford prescriptions consistently, they may skip doses, delay refills, or reduce usage without consulting a physician. This can lead to preventable health complications and increased hospital visits. Policies aimed at reducing these financial barriers are often discussed as part of broader public health strategies. If implemented effectively, pricing reforms may help reduce uncertainty in monthly healthcare expenses and improve access to needed treatments. Another major topic connected to this bill is Social Security. Social Security remains one of the primary income sources for millions of retirees. For many households, these monthly benefits help cover essential expenses such as rent, food, insurance, transportation, and utilities. Because of its importance, any legislative discussion involving Social Security naturally attracts public attention. One area of continued debate is how annual cost of living adjustments are calculated. These adjustments are intended to help benefits keep pace with inflation. However, some analysts and advocacy groups have argued that current formulas may not always reflect the spending realities of retirees, who often allocate a larger share of their budget to healthcare, medications, and personal assistance. The legislation encourages further examination of these issues and supports discussion around methods that more accurately represent senior spending patterns. Long-term program stability is another recurring issue. Discussions about trust fund projections, payroll tax structures, and demographic shifts are common whenever policymakers review Social Security sustainability. While these technical topics can seem distant from daily life, they matter because they influence how future benefits are funded and managed. Many retirees, as well as younger workers planning ahead, closely follow these conversations because of their long-term importance. Long-term care and nursing home quality are also central components of the legislation. Families placing a loved one in a care facility often face difficult decisions. Beyond cost considerations, there is the emotional concern of ensuring a parent, spouse, or relative receives respectful and competent care. Reports over the years have highlighted issues such as understaffing, delayed assistance, inconsistent sanitation standards, and limited oversight in some facilities. In response, the bill proposes stronger accountability standards for facilities receiving Medicare or Medicaid funding. This includes clearer staffing expectations, stronger reporting systems, and more accessible information for families researching care options. Greater transparency may allow individuals to review inspection histories, staffing patterns, and facility performance more easily. These types of reforms matter because quality of care often depends on adequate staffing and proper oversight. A well-supported facility is better positioned to provide medication management, mobility assistance, meal support, hygiene services, and emotional care to residents. Families often want reassurance that loved ones are not only safe, but treated with dignity and compassion. Financial fraud prevention is another major focus. Older adults are frequently targeted by scams ranging from fake government calls to fraudulent investment opportunities. In many cases, scammers exploit urgency, confusion, or emotional vulnerability. Common tactics may include impersonating financial institutions, healthcare representatives, or family emergencies. The bill includes provisions designed to strengthen prevention and response efforts. This may involve greater coordination between financial institutions, law enforcement, consumer protection agencies, and educational outreach programs. Public awareness remains a critical defense. The more individuals understand common scam patterns, the easier it becomes to identify suspicious behavior before harm occurs. Banks and credit unions may also play a larger role in identifying unusual account activity. In some cases, sudden withdrawals, repeated wire transfers, or abrupt account changes can indicate exploitation. Policies that improve reporting systems may help identify concerning patterns earlier while preserving consumer protections. Housing and aging in place are equally important topics addressed by the legislation. Many seniors prefer remaining in their own homes for as long as possible. Familiar surroundings, neighborhood relationships, and independence all contribute to quality of life. However, aging in place often requires physical modifications. Simple changes such as grab bars, improved lighting, ramps, stair railings, widened doorways, or accessible bathrooms can significantly improve safety. Unfortunately, these upgrades may be financially difficult for retirees living on fixed incomes. The legislation proposes expanded assistance programs to support accessibility improvements through grants, subsidies, or financing initiatives where available. This approach recognizes that safe housing is closely linked to health outcomes. Falls are one of the most common causes of injury among older adults. Preventative modifications can reduce risk while allowing individuals to maintain autonomy longer. The bill also touches on broader affordable senior housing needs. Demand for accessible and affordable housing continues to grow as the population ages. Communities designed with healthcare proximity, transportation access, and social opportunities can contribute positively to physical and emotional well-being. Social connection itself is increasingly recognized as an important health factor. Loneliness and isolation can affect both mental and physical health. For this reason, community-centered housing models have gained attention in aging policy discussions. Mental health access is another meaningful component of the legislation. Emotional well-being is sometimes overlooked in conversations about aging, despite its importance. Older adults may experience grief, retirement adjustment, caregiving stress, health anxiety, chronic pain, or changing family dynamics. These experiences can contribute to emotional strain. The bill supports broader access to counseling, behavioral health resources, and telehealth services. Telehealth is particularly valuable for individuals with transportation barriers, mobility limitations, or geographic distance from providers. Virtual care options can increase flexibility while reducing logistical burdens. Caregiver support is another area receiving attention. Family caregivers provide enormous value within the healthcare ecosystem. Many assist loved ones with appointments, medication schedules, meal preparation, transportation, household management, and emotional support. This work is often unpaid and can be physically and emotionally demanding. The legislation includes support measures such as caregiver resources, educational programs, and potential financial relief mechanisms. Respite services are also important because caregivers benefit from temporary support that allows them to rest and manage personal needs. Medicare-related service gaps, including hearing, vision, and dental care, are also discussed. These services are highly relevant to senior health. Hearing challenges can affect communication and social participation. Vision issues influence safety, mobility, and independence. Oral health affects nutrition, comfort, and broader medical outcomes. While full coverage expansion remains a complex policy issue, the bill includes incremental steps intended to improve access in targeted areas. These may include expanded support programs, pilot initiatives, or funding adjustments designed to reduce barriers. Another important aspect to understand is how implementation typically works after legislation is introduced or passed. Federal agencies often develop detailed rules and guidance that determine how programs operate in practice. This process can involve timelines, public comment periods, and coordination between federal and state governments. As a result, even when a policy is approved, the real-world impact may take months or even years to fully develop. This is why patience and ongoing awareness are important. Policies evolve, and updates may change how certain benefits are delivered or who qualifies. Staying informed helps individuals adjust plans as new information becomes available. It is also useful to consider how different parts of the bill may affect people differently. For example, someone currently receiving Medicare benefits may experience changes differently than someone who is still working and planning for retirement. A family caregiver may focus more on support services, while another individual may be more concerned with housing or prescription costs. Because of these differences, there is no one-size-fits-all outcome. Understanding your personal situation is key. Reviewing your current benefits, healthcare coverage, and financial plans can help you determine which aspects of the discussion are most relevant to you. Another practical step is maintaining organized records. Keeping track of important documents such as Medicare information, Social Security statements, prescription lists, and financial records can make it easier to respond to any changes or opportunities. Organization reduces stress and allows quicker decision-making when needed. Communication with family members is also important. Many decisions related to healthcare, housing, and finances involve more than one person. Having open conversations about preferences, expectations, and plans can prevent confusion later. This is especially helpful when planning for long-term care or discussing caregiving responsibilities. Community resources can also play a valuable role. Local organizations, senior centers, and nonprofit groups often provide educational programs, counseling services, and support networks. These resources can help individuals stay informed and connected. Technology is another area worth mentioning. While it can sometimes feel overwhelming, technology can also provide useful tools for managing health, finances, and communication. Online portals, telehealth services, and financial monitoring tools can simplify tasks that once required in-person visits. At the same time, it is important to approach technology carefully and securely. Using strong passwords, avoiding suspicious links, and verifying websites can help reduce risks associated with online activity. Returning to the broader picture, the Elder Care Protection Bill reflects an ongoing effort to address the realities of an aging population. As life expectancy increases and healthcare needs evolve, policies must adapt to changing circumstances. This requires ongoing dialogue between policymakers, healthcare providers, families, and communities. While legislation can provide a framework, real impact depends on how programs are implemented and how effectively they reach the people they are intended to support. Monitoring progress, providing feedback, and staying engaged all contribute to better outcomes over time. It is also important to recognize that individual planning remains essential regardless of policy changes. Personal savings, healthcare planning, insurance coverage, and lifestyle choices all play a role in long term well being. Legislation can provide support, but personal decisions continue to shape outcomes. Another point worth discussing is the importance of preventive healthcare. Regular checkups, screenings, vaccinations, and early interventions can help reduce long term medical costs and improve quality of life. Many healthcare systems are placing greater emphasis on prevention rather than only treating illness after it develops. Nutrition and physical activity also play a significant role in healthy aging. Even moderate daily movement, balanced meals, and consistent routines can contribute to maintaining strength, mobility, and overall well being. Small habits practiced consistently can have meaningful long term effects. Financial literacy is another area that can make a difference. Understanding budgeting, savings, insurance options, and basic financial planning can help retirees manage their resources more effectively. Access to clear, simple information is key in this area. Planning for unexpected events is also important. Having an emergency fund, understanding insurance coverage, and preparing legal documents such as wills or healthcare directives can provide peace of mind. These steps help ensure that decisions are handled according to personal preferences. Social engagement should not be overlooked. Staying connected with friends, family, and community groups supports emotional well-being and can reduce feelings of isolation. Activities such as volunteering, joining clubs, or participating in local events can provide a sense of purpose and belonging. Transportation access is another practical concern. Reliable transportation allows seniors to attend medical appointments, shop for necessities, and stay socially active. Community programs that support transportation services can play an important role in maintaining independence. As you continue to follow updates related to this legislation, remember that information may evolve. New details, clarifications, or adjustments may be introduced over time. Keeping an open and informed perspective will help you adapt as needed. Another aspect worth considering is how education plays a role in long-term independence. Lifelong learning can help seniors stay mentally active, engaged, and confident in navigating changing systems. Whether it involves understanding new healthcare options, learning digital tools, or staying updated on financial planning strategies, continuous learning supports independence and resilience. Volunteering opportunities also provide meaningful ways for older adults to stay active and connected. Contributing time and experience to community organizations can strengthen social bonds and create a sense of purpose. Many communities benefit greatly from the wisdom and experience that seniors bring. Intergenerational connections are equally valuable. Spending time with younger family members or participating in community programs that connect different age groups can be enriching for everyone involved. These interactions help build understanding and create supportive networks across generations. Another practical consideration is emergency preparedness. Having a plan in place for natural disasters, medical emergencies, or unexpected disruptions can make a significant difference. Keeping emergency contacts accessible, maintaining a list of medications, and preparing basic supplies are simple steps that improve readiness. Access to clear communication is also important. Understanding healthcare instructions, financial documents, and legal agreements requires clarity. Asking questions and seeking clarification when needed ensures that decisions are made with full understanding. As policies continue to evolve, flexibility becomes an important skill. Being open to adjusting plans, exploring new resources, and adapting to changing circumstances helps individuals maintain stability even when external factors shift. Ultimately, the Elder Care Protection Bill reflects a broader conversation about how society supports aging populations. Healthcare affordability, retirement security, housing safety, and fraud protection are not isolated concerns. They are interconnected parts of daily life for millions of individuals and families. No single bill can solve every challenge, and policy outcomes depend on implementation, oversight, and continued public engagement. Still, discussions like these highlight important priorities affecting current and future retirees. Whether you are already retired, approaching retirement, supporting aging parents, or simply planning ahead, understanding these topics can help you feel more prepared. Awareness supports better decision making, reduces uncertainty, and helps families navigate complex systems with greater confidence. As policies continue evolving, staying educated remains one of the strongest tools available to you. Knowledge allows you to ask better questions, identify opportunities, avoid misinformation, and make informed choices that align with your needs and goals. It also helps you participate more effectively in conversations that shape future policy decisions. Taking small steps consistently can make a meaningful difference over time. Reviewing your financial plan, staying current with healthcare coverage, maintaining communication with family members, and engaging with community resources all contribute to a stronger foundation for the future. Even though policy discussions can sometimes feel distant, they ultimately connect back to everyday experiences. Access to care, financial stability, safe housing, and emotional well-being are deeply personal issues that affect quality of life. By staying aware, asking questions, and using trusted resources, you place yourself in a better position to respond to changes as they occur. This approach helps you move forward with clarity and confidence. Knowledge remains one of the most valuable tools you have. Subscribe my channel for more valuable content, and please turn on bell button.